Hi there. My name is Dr. Niamh Lynch and I'm a paediatrician with an interest in concussion. You've probably noticed that concussion is getting a lot of attention recently, and you might be wondering what to do if your child has a concussion. The most important thing to remember when managing concussion is that recognition is crucial. 1 in 3 children will have a concussion before they reach the age of 16. Concussion can happen to any child on or off the sports pitch, and the youngest child I have treated for concussion was only 1.5 years old. I'm going to talk to you about 2 things. Firstly, what happens to the brain when a concussion occurs, and secondly, how to recognise concussion in your child. So what is concussion anyway, and why is it such a big deal? Your brain sits inside your skull in a special fluid called CSF. This helps to cushion your brain from impacts against the skull during normal, everyday movements of the head. But a blow to the head or a strong whiplash type motion can cause your brain to bump back and forth against the inside of your skull. The impact of your brain bumping around can strain and injure fragile brain tissue, and in more serious cases can cause bruising or bleeding. This damage may not be obvious since it is not outwardly visible. And don't forget, the majority of people with concussion never lose consciousness. This is why it's important to be able to recognise the symptoms of concussion, especially in children who may not be able to express clearly how they are feeling. Remember, a second concussion occurring soon after the first, when a child is still symptomatic, can sometimes lead to a thing called second impact syndrome, which causes uncontrolled swelling of the brain, resulting in severe illness, brain damage, or even death. So how can you recognise concussion in your child? Remember, the majority of children who sustain a concussion never lose consciousness. You might not have witnessed your child being injured, or the child might have appeared fine after the initial injury. Symptoms of concussion can take several hours to develop in children. There are 4 different types of symptom a child can have after a concussion. These are physical, cognitive, emotional, and sleep disturbance. The physical symptoms include headache, dizziness, balance problems, nausea, and visual problems. Cognitive symptoms mean that the child may have memory problems or issues with attention and concentration. Emotional symptoms include irritability, anxiety, tearfulness, and frustration. Sleep disturbance can mean that the child has difficulty falling asleep or staying asleep, and in the morning they do not feel rested. If your child has these symptoms, then rest from sport and rehabilitation is essential. If an initial concussion is not appropriately managed in a child, that child is 10 times more likely to have a second concussion. But concussion is very treatable, and most children make a full recovery. So remember, when you recognise that your child has a concussion, you've helped your child to take the first step on the road to recovery. Thank you for watching.